Let's talk about one of the most fascinating and delicate sensory organs we've got, the ear. It pulls double duty with two vital jobs, hearing and balance. Hearing isn't just about listening to music or conversations. It's essential for the development and maintenance of speech and communication. Balance, or equilibrium, is what lets us walk, run, and even stand still without tipping over. When either of these functions is off, life gets a lot harder. That's why early detection and accurate diagnosis of ear disorders is so important. The external ear. The outside of the ear, called the auricle or pinna, is mostly cartilage with a little fat in the earlobe. Its job is simple: collect sound waves and funnel them into the external auditory canal. That canal runs about 2 to 3 centimeters and ends at the tympanic membrane, the eardrum. It's lined with skin, hair, and glands that make cerumen, better known as earwax. Here's a helpful fact. The ear has a built-in self-cleaning system. Old skin cells and wax slowly migrate outward, so in most cases, ears don't need extra cleaning. The middle ear behind the eardrum sits the middle ear, a small air-filled cavity. The middle ear connects to the back of the throat through the eustachian tube. Normally it's closed, but it opens when we swallow, yawn, or do a Valsalva maneuver. Its purpose is to drain fluid and equalize pressure. That's why your ears pop on an airplane. The eardrum itself is thin, pearly gray, and has 3 layers. Most of it is strong, called the pars tensa, but one small section, the pars flaccida, is weaker and more prone to disease. Inside the middle ear are the 3 tiniest bones in the human body: the ossicles, the malleus, the incus, and the stapes. They act like a lever system, amplifying vibrations from the eardrum and sending them to the inner ear. The inner ear. Deep inside the temporal bone is the inner ear, which houses the organs of hearing and balance. The cochlea handles hearing, while the semicircular canals, the utricle and the saccule, handle balance. All of this sits within the bony labyrinth, filled with protective fluid called perilymph, while the membranous labyrinth inside is filled with endolymph. At the heart of it all is the organ of Corti, located on the basilar membrane of the cochlea. Here's where the magic happens. Sound vibrations get converted into electrical signals that travel along the vestibulocochlear nerve. Cranial nerve 8 to the brain. That's how the brain makes sense of a sound as a word, a song, or a car horn. How hearing works. There are 2 ways sound gets to the inner ear. First, air conduction. Sound waves travel through the ear canal, vibrate the eardrum, move the ossicles, and reach the cochlea. Second, bone conduction. Sound bypasses the middle ear entirely and goes straight through the skull bones to the cochlea. Air conduction is more efficient, but bone conduction becomes important when we're testing hearing or when the middle ear isn't working properly. How balance works. Balance depends on teamwork. The vestibular system in the inner ear senses head position and movement. The visual system provides orientation. And the proprioceptive system, muscles and joints, tells the brain what the body is doing. The cerebellum pulls all this data together. If any part of this chain breaks down, like with a vestibular disorder, poor vision, or decreased blood flow to the brain, balance is affected. That's when patients complain of dizziness, vertigo, or unsteadiness. Diagnostic evaluation. Now let's talk about how we test the ear. Nurses don't run most of these tests, but we play a huge role in preparing patients, explaining what to expect, and watching for red flags. Audiometry is the gold standard for detecting hearing loss. There are 2 main types. Pure tone audiometry uses musical tones, and speech audiometry uses spoken words to test discrimination. The results are plotted on an audiogram, which shows whether hearing loss is conductive, sensorineural, or mixed. A tympanogram checks how well the eardrum moves by changing pressure in the ear canal. It's especially useful for middle ear problems. Auditory brainstem response, or ABR testing, measures electrical activity from cranial nerve 8 and the brainstem in response to sound. It's helpful for infants, uncooperative patients, or when we suspect issues like acoustic neuroma. Electronystagmography records eye movements during vestibular stimulation. It helps diagnose vertigo or unexplained hearing loss. Patients need to avoid caffeine, alcohol, and certain medications before the test. Platform posturography measures how well patients use visual, vestibular, and proprioceptive input to stay balanced while standing on a moving platform. Sinusoidal harmonic acceleration, also known as the rotary chair test, evaluates eye movement responses to rotation. Middle ear endoscopy is a specialized procedure performed by ENT doctors. A tiny scope is inserted into the middle ear to look for conditions like fistulas or chronic infections. Hearing loss classification. Hearing loss is measured in decibels. 0 to 15 decibels is normal hearing. Greater than 15 to 25 is slight hearing loss. Greater than 25 to 40 is mild. Greater than 40 to 55 is moderate. Greater than 55 to 70 is moderate to severe. Greater than 70 to 90 is severe. And greater than 90 is profound hearing loss. To put this into perspective, rustling papers are about 15 decibels. A normal conversation is about 40. And a jet engine 100 feet away is about 150 decibels. Prolonged exposure above 80 can permanently damage hearing. Bottom line. The ear might be small, but its role in hearing and balance makes it one of the most important sensory organs we've got. For nurses, the key is knowing the anatomy and physiology, understanding how hearing and balance are assessed, and being able to prepare and educate patients about the process. Early recognition of problems helps preserve function, independence, and quality of life.